Hi everyone, I am Dr. Divya Shanthi and welcome to the NEET PG Core Revision series. These series are structured, focused and exam oriented so that you can recall faster and more confidently in your exams. And in today's series, we will be breaking down the triangles of neck into clear, simple and high yielding exam oriented concepts. So let's get started. So the triangle of the neck, basically if you see the side of the neck, okay, so here if you see the neck is quadrangular, okay, the side of the neck is quadrangular in shape and this space is divided by this sternocleidomastoid, okay, by the sternocleidomastoid muscle into a posterior triangle and into an anterior triangle. So this part we call it as the anterior triangle, anterior to the sternocleidomastoid as the anterior triangle and posterior to that the posterior triangle of the neck. So these are the two main triangles which we see in the side of the neck. So the sternocleidomastoid, it will extend from the sternum up to the mastoid process, will be running obliquely, okay, backwards and dividing this entire quadrangular space into two triangles. So let's see these triangles, their subdivisions and the important contents, because in these triangular spaces there are very important nerves, vessels, okay, of the head and neck region, and so study of this is very important. So coming to the subdivisions now here. So this is the sternocleidomastoid muscle. So it divides here, this will be the posterior triangle which is bounded, okay, by the sternocleidomastoid anteriorly as well as the trapezius posteriorly, whereas here anteriorly we have this anterior triangle of the neck, okay. So these two triangles we see in the side of the neck. So and you can see here these triangles are further subdivided. So first we will look at the posterior triangle, the posterior triangle of the neck. So the posterior triangle of the neck, when we see, okay, so it is on the side of the neck. The posterior triangle is basically a triangular space on the side of the neck behind the sternocleidomastoid. So its apex is directed. So this is the apex. So if when we say a triangle, the triangle will have an apex, a base and two sides. So this is the apex here, which is directed towards the mastoid process. The base is downwards, which is formed by the middle third of the clavicle. This is the base which is formed by the middle one third of clavicle, and the anterior border, if you see here, is formed by the posterior border of the sternocleidomastoid. So the sternocleidomastoid muscle has two heads, the sternal head, the clavicular head. So here this forms the anterior border, okay. So the anterior border is formed by the posterior border of sternocleidomastoid, whereas the posterior border here is formed by the which one? The trapezius, that is the anterior border. So posterior border is formed by the anterior border of trapezius, okay. So these are the boundaries, and if you see there is a small muscle here, this muscle is the inferior belly of omohyoid, okay. So this muscle we call it as the inferior belly of omohyoid, which will divide this entire posterior triangle into a larger occipital. So this is the occipital triangle and this is the supraclavicular, or it is also called as the subclavian triangle, okay, occipital and subclavian triangle. So that is the boundary of posterior triangle. Let's see the flow. So this again just a quick recap about the boundaries. So we have the trapezius here, anteriorly we have the sternocleidomastoid, this is the base formed by the middle third of clavicle and this is the apex, okay, where meeting point of the sternocleidomastoid and trapezius, okay, the superior nuchal line and mastoid process here you can see. So this part, and you can also see the inferior belly of omohyoid dividing into a larger occipital triangle and a smaller subclavian triangle. So let's look at when we say the boundaries, it also includes the roof and the floor. So the roof here, if you see, is formed by the investing layer, okay. So the roof is formed by the investing layer of deep cervical fascia, investing layer of the deep cervical fascia. So this fascia, which stretches between the sternocleidomastoid and the trapezius, will be forming the sternocleidomastoid and trapezius will be forming the roof. So if you see here, the roof, okay, is pierced. So above this cervical fascia, so investing layer is basically part of the deep fascia. So above that there is the superficial fascia. We have a small portion of platysma muscle also can be seen there, and overlying skin will be there. So piercing this fascia, we can see here the cutaneous nerves, okay. So the cutaneous nerves, we see the 4 cutaneous nerves. So which are those 4 cutaneous nerves? See, which is passing transversely here. This is the transverse cervical, transverse cervical nerve, okay. This is the transverse cervical nerve. So these are basically from the cervical plexus, so C2, C3, transverse cervical. Then here one is running obliquely here. This nerve is the great auricular nerve, okay, and here we have the lesser occipital nerve, lesser occipital nerve, okay. This is C2 root value, this is C2, C3. So these 3 nerves we see here, and here we see the supraclavicular nerves, okay, supraclavicular nerves. So this supraclavicular C3, C4, okay. So supraclavicular nerves will be running downwards. So you can see one across transverse cervical, one obliquely towards the angle of the mandible, it will be running. So it supplies the skin over that region. So that is the great auricular nerve. Then along the posterior border of sternocleidomastoid, we have the lesser occipital, and running downwards will be the supraclavicular nerves. And one of them, actually the middle one, it sometimes pierces the clavicle also. So these nerves here, where the point where they emerge, right, this we call it as the nerve point. Okay, so the nerve point is the meeting point, or the point where all these nerves are not exactly meeting, but where all these nerves pierce and come out. Okay, so that is usually, if we see, at the junction of the lower 2/3 and upper 1/3. Okay, so junction of lower 2/3 and upper 1/3, we will see the nerve point. Deeper to that point, we also see in the content, we also see the spinal root of spinal accessory nerve, basic spinal accessory nerve will be running there. So we see that in the deeper content, but here in the roof we see these. So this point is used, like, you know, for giving anesthesia. When we have to give a nerve block, we give it at this point. And also we need to bear in mind while any surgical approach in this region. Okay, so this nerve point we should be aware of, so that to avoid the injury. So above that nerve point is the safe part of the triangle, we say, whereas below that is the unsafe part, because below that, at that point and below, we have many nerves and vessels and all those things, but above that it is relatively less of nerves and vessels there, and it is safer there in the upper part. Then we have and including and along with this, in the roof we also see the external jugular vein. Okay, external jugular vein is seen. So this we see it in the roof. Then coming to the floor of the posterior triangle. So, the floor of the posterior triangle, when we see from above downwards, it is formed by the semispinalis capitis, muscle, then splenius capitis, levator scapulae, and the scalenus medius. Okay. So, these four muscles, they form the part of the roof from above downwards. Sometimes we can also see the first digitation of serratus anterior also. Right. So, these muscles, they are covered. Okay. So, they are covered by the prevertebral layer of the deep cervical fascia, and that forms a facial carpet of the floor of this triangle. Now, this is important because in cases of tuberculosis of the cervical vertebrae, okay, untreated cases, there may be an abscess, and that abscess can get collected, can be seen beneath this fascia in the posterior triangle region. And this same abscess can also be seen down in the axilla. Now, how do we see it in the axilla? Because these prevertebral fascia, okay, so this prevertebral fascia which will be covering these muscles, okay, the prevertebral fascia will form the axillary sheath. Okay, prevertebral fascia will form the axillary sheath downward, covering the subclavian artery as well as the brachial plexus, okay, the brachial trunks which are beginning from the root of the neck and will be running towards the axilla. Okay, they will pass towards the axilla through the cervicoaxillary canal. So, this fascia will extend down as the axillary sheath. So, that is why this abscess, okay, which tuberculous abscess, we call it as cold abscess, because the usual signs of inflammation we do not see there. Okay, the signs of inflammation being the rise of temperature, okay, and redness and all those things, we do not see it there. Okay, 𝗕𝗵 tumor we say. So, those the signs we do not see here. It is there is no redness or there is no rise of temperature. So, that is why we call it as the cold abscess, and this cold abscess can extend downwards to the axilla also because of this anatomical relation there. So, that is about the floor and roof. Now, we come to the contents. Okay. So, the inferior belly of omohyoid was dividing this triangle into larger occipital and a smaller, we had the subclavian or the supraclavicular. It is called subclavian because the subclavian vessels are seen there, and supraclavicular because it is above the clavicle. So, if you see now, this is the larger occipital triangle. So, in the larger occipital triangle, now from above downwards we will go, whatever structures are seen. So, here we can see the occipital lymph nodes. Okay. So, these are the occipital lymph nodes. We see the occipital artery, then we see the initial, okay, so these nerves which are just emerging there from the cervical plexus, we have the, this is the lesser occipital nerve, then we have the great auricular nerve, this is the great auricular nerve, and here we have the transverse cervical nerve. Okay, and here these are the supraclavicular nerves. And here you can see running across will be the spinal accessory nerve. And this is the superficial branch of transverse cervical artery. Superficial branch of transverse cervical artery. This is the dorsal scapular artery. Okay, this is the transverse cervical vein. vein. So these are the main structures which we see in the occipital triangle. So I told you this is the nerve point, and above that, see here you cannot, there are no nerves here. So this is generally the safe part of the triangle. So this is the safe part of the triangle above the nerve point. Below it is the unsafe part of the triangle. So in the subclavian triangle, when we see here, okay, so in the subclavian triangle we see the third part. Okay, so this is the third part of subclavian artery, third part of subclavian artery. We see the subclavian vein, and we see the trunks of brachial plexus. So these are the trunks of, so we have three trunks, right, of the brachial plexus, upper, middle and lower trunk. So trunks of brachial plexus is seen here. Right. So this is the subclavian triangle because it is the subclavian vessels can be found here, and supraclavicular because it is above the clavicle. So that is why we call it as the subclavian or supraclavicular triangle. So important thing here to remember is the nerve point, okay, as well as the injury of the spinal accessory nerve. Okay, so this can cause injury because it supplies the trapezius. So it can result in the paralysis of trapezius muscle. Okay, so shrugging of shoulders, and those movements can be affected. The patient will be basically complaining about difficulty to comb the hair. So this is all about the posterior triangle. Now next, moving on to the anterior triangle of the neck. So the anterior triangle of the neck, if we see, it is the larger triangle on the side of the neck. So this is basically here the anterior triangle is formed, okay, the boundaries, if you see, the apex, here the posterior triangle, the apex was directed upwards, right? Here the apex is directed downwards. Okay, so this is the apex. So here it is bounded anteriorly by the anterior median line. Okay, so the anterior median line which extends from the, this is the anterior median line which extends from the symphysis menti up to the sternal notch. So this is the anterior median line of the neck. The posterior boundary here, it is formed by the anterior border of the, okay, so posterior boundary is basically the anterior border of sternocleidomastoid muscle. The base here is formed by the lower border of the body of the mandible. So this is the base of the mandible. This forms the, or the lower border of the body of mandible will form the base, okay, and here where there is a gap, okay, it's an imaginary line which extends from the angle of the mandible up to the mastoid process. So that is the line which will be extending from angle of mandible up to the mastoid process. So this forms the base. So this is the triangle. Now this triangle is further description purpose by two muscles. It is divided into 3.5 triangles on each side. Okay, 3.5 triangles. One triangle is shared by both the right side and the left side. So which are those two muscles which divide? We have the superior belly of omohyoid, superior belly of omohyoid, as well as the anterior, okay, anterior and posterior belly of digastric. Okay, anterior and posterior belly of digastric muscle. Okay, so anterior belly and posterior belly of digastric muscle and the superior belly of omohyoid will divide this anterior triangle into 3½ triangles. So, which are those 3½ triangles? We have half of submental triangle on each side. Okay, so submental triangle is shared. This is the muscular triangle. This is the submandibular or digastric triangle, we say digastric triangle, and we have the carotid. So, the most important triangles here are the digastric and the carotid because they contain the important nerves, vessels, glands in the head and neck region. So, we will study these two triangles a little more in detail. So, first coming to the digastric or the submandibular. Since it is below the mandible, we call it as the submandibular, and since it is bounded by the digastric muscle, we call it as the digastric triangle. So, when we see the boundaries of the digastric triangle, so the boundaries here of the digastric triangle, okay, so the digastric triangle is something like this. Okay, so here it is basically formed by the base of the mandible, okay, that is the lower border of the mandible here, and the line extending from the angle of the mandible up to the mastoid process. So, that will form the base of the triangle. Okay, so base of the mandible with the line extending from the angle to the mastoid process. Then antero-inferiorly, okay, so this is the antero-inferior, anteriorly and inferiorly. So, antero-inferiorly we have the anterior belly of digastric muscle, and posterior-inferiorly we have the posterior belly of digastric muscle. Okay. So, apex. So, apex here it is formed by the intermediate tendon of the digastric muscle. So, this is the intermediate tendon by which both the heads they are inserted to the near the hyoid bone. Okay. So, intermediate tendon. So, that will form the apex. Okay. So, this is the intermediate tendon where it is tendon is bound down by this fascial sling which is derived from the investing layer of the deep cervical fascia. So, it forms a sling and holds that tendon to the hyoid bone. And along with this posterior belly of digastric, we also see the stylohyoid muscle also, which contributes to the posterior-inferior boundary of the triangle. So, coming to the floor of the triangle. Okay, so the floor of the triangle when we see, okay, so this is the floor of the triangle. So, floor of the triangle here is formed by the mylohyoid muscle. Okay, so here we have the mylohyoid. This is the mylohyoid muscle. Then we have the hyoglossus muscle. This is the hyoglossus muscle as well as the middle constrictor, small part of the middle constrictor muscle. So, these muscles they form the middle constrictor. Okay, they form the floor. Coming to the contents now. Okay, so the contents here. So, floor these 4 muscles are formed, and the roof here it is formed by again the investing layer of the deep cervical fascia. So, this investing layer of the deep cervical fascia in this region will be splitting to enclose this submandibular gland. Okay, and along with that we also see the superficial fascia, the platysma muscle is seen, the cervical branch of facial nerve is also seen in the roof of the digastric triangle. Okay. Coming to now the contents. So, the contents here, the digastric triangle here if you see it is divided into an anterior and the posterior part by the ligament. Okay. So, this stylomandibular ligament will be dividing this triangle into an anterior part and a posterior part. So the posterior part here will be slightly deeper and it will be continuous above with the parotid region. So in the anterior part, okay, so we will see first the contents in the anterior part. So the contents here, what are we seeing? Mainly the submandibular gland. The submandibular gland is seen. Okay, so this is the submandibular gland. We see the submandibular lymph nodes. Okay, so we are seeing the submandibular lymph nodes. Then we see superficial to the submandibular gland, there is the facial vein. So facial vein, remember that it is superficial, whereas the facial artery will be deeper to the gland. Facial artery will be deeper to the gland before it emerges on the face, so it will be lying deeper to the gland. Then we also see the hypoglossal nerve. Hypoglossal nerve. In addition to that, we also see the submental artery, okay, as well as the mylohyoid nerve and vessels. So these are the contents in the anterior part of the triangle. Okay, so anterior part of the digastric triangle, we see these. So here usually in this part, submandibular triangle is basically the site of swelling, because the gland may swell the lymph nodes. Okay, so the lymph nodes basically they drain from the anterior 2/3 of the tongue, from the floor of the mouth, from the frontal, ethmoidal, as well as the maxillary air sinuses. They all drain into this group of lymph nodes. So from this, the efferents, they drain into the jugulo-omohyoid mainly, and partially to the jugulo-digastric group of lymph nodes. Okay, so that is why we see swelling in these regions more commonly. Now coming to the posterior part of the triangle. So posterior part of the triangle mainly consists of the external carotid artery. Okay, we have the external carotid artery and the carotid sheath, which will be enclosing these carotids, the internal jugular as well as the vagus nerve. We will see the carotid sheath also there, as well as the structures passing between the external and internal carotids. So the structures passing between the two external and internal carotids, we see the deep part of, so we have the deep part of parotid gland. Then we have the styloglossus muscle, the stylophyllangeus muscle, the glossopharyngeal nerve, and the pharyngeal branch of vagus nerve. Okay, so these structures, the deep part of the parotid gland, the styloglossus muscles, the stylopharyngeus muscle, which is supplied by the glossopharyngeal, so they go run together, and we also see the pharyngeal branch of the vagus nerve. So these structures, they form the contents in the posterior part. Next we will move on to the other important triangle of the anterior region. Here we see the carotid triangle. Okay, so carotid is a very important triangle here. It is so called because all the three carotids, the common carotid along with its branches, the external as well as the internal carotid, we see in this region. So here the superiorly, okay, so superiorly here the superior boundary is formed by the posterior belly of digastric supplemented with the stylohyoid muscle. Okay, stylohyoid plus posterior belly of digastric. Whereas anterior-inferiorly, okay, anterior-inferiorly here, anterior-inferiorly we have the superior belly of superior belly of omohyoid. So that forms the antero-inferior border. And posteriorly, if you see here, it is formed by the anterior border of the sternocleidomastoid. Okay. So here it is formed by the posterior. We will see the anterior border of sternocleidomastoid. So that will be the middle 1/3 here. Okay. So this portion here. And the roof is formed by the investing layer of the cervical fascia. The superficial fascia over that will contain the platysma muscle, the cervical branch of facial nerve, as well as the transverse cervical nerve, okay, which we see, which will be running across the sternocleidomastoid, and we see it coming to that region. The floor here, the floor of the triangle is formed by the, okay, so floor here is formed by the thyrohyoid muscle, then we have the hyoglossus. Okay, so we have the hyoglossus muscle here in the upper part. This is the hyoglossus. Okay, and we have the middle constrictor. This is the middle constrictor of pharynx, and here we have the inferior constrictor. Okay, middle and inferior constrictor of the pharynx. So these, they form the floor. Then coming to the contents. So the contents mainly are the carotid arteries. So the carotid arteries, which include carotid arteries, which include the common carotid artery, the external carotid artery with its branches, and the internal carotid artery. So the internal carotid artery here, it doesn't give any branches. So internal carotid artery is mainly the artery supplying these structures in the cranial cavity. So it will not give any branch here. But the external carotid artery, we can see the 5 branches of external carotid artery in this region. So here we can see this is the superior thyroid. This is the superior thyroid artery. Then we have the ascending pharyngeal artery. Then we see the lingual artery. This is the facial, and this is the occipital branch, occipital artery. So these 4 arteries here, I mean altogether there are about 5 branches of external carotid which we see in this region. Sometimes this lingual and facial artery will have a common trunk, which we call it as the linguofacial trunk. This is the internal carotid, and we also see the internal jugular vein. Then we see the vagus, 3 cranial nerves we will see. Okay, so the vagus, the hypoglossal, as well as the spinal accessory. So 3 nerves we can see here. Then we have the carotid body. So here in this part we see the carotid body and the sinus, carotid body and the sinus. Then the carotid sheath enclosing these carotids, the internal jugular artery as well as the vagus nerve, and on the anterior wall of the carotid sheath we also see the ansa cervicalis. And along with this we will also see the deep cervical lymph nodes and the deep sympathetic chain. Okay, cervical part of the sympathetic chain is also seen in this region. Okay, they all form the contents. So the nerves here, which we can see mainly, this is a closer view of the nerves in this region. So we can see the hypoglossal nerve. Okay, so hypoglossal nerve is seen. Okay. We see the vagus. Here we can see the spinal accessory. And this is the ANSA. This loop is called as the ANSA cervicalis. Okay, cervicalis. So this is the loop formed by ascendens and descendens hypoglossi as well as the descendens cervicalis hyposia. So this is the ANSA. ANSA is the loop basically which is formed by the superior root and the inferior root. Superior root is called descendens hypoglossi. This is called as the descendens cervicalis. So thus in this region, basically in the carotid triangle, we see the hypoglossal nerve, the spinal accessory nerve, the vagus nerve and the ANSA, formation of the ANSA cervicalis. So here in this triangle, we can compress the carotid artery. Okay, so the carotid artery, especially the common carotid artery, is compressed against the prominent anterior tubercle of C6. Okay, the sixth cervical vertebrae C6 against the transverse process of this. Transverse process of this, we can compress the common carotid artery. So this is known as the carotid tubercle. Okay, so this C6, the transverse process of that, it is called as the carotid tubercle, or it is also known as 𝗤𝗔𝗔𝗡𝗥𝗡 tubercle. 𝗤𝗔𝗔𝗡𝗥𝗡 tubercle. Okay, 𝗤𝗔𝗔𝗡𝗥𝗡 tubercle or carotid tubercle, which means the same. So the carotid tubercle lies about 4 centimeters above the sternoclavicular joint. So these are the things which we see here. And let's move on to the next, the carotid sheath, which we see. So carotid sheath is basically, it's a tubular condensation. It's a tubular condensation of the deep cervical fascia. Okay, so of the deep cervical fascia. So it's basically wedged between the investing layer, the pretracheal. So pretracheal fascia will be in the front, the prevertebral fascia behind, and it is attached to all those investing layer, the pretracheal, prevertebral layer, right? So this carotid sheath, and the carotid sheath, it extends above from the base of the skull. Okay, so from the base of the skull up to the arch of aorta. Below it will extend up to the, so from there up to the arch of aorta. So at the base of the skull, it is attached to the margins of the carotid triangle as well as to the jugular foramen margins, whereas in the lower part it is attached, it blends basically with the tunica adventitia of the arch of aorta. Okay, so it blends with the tunica adventitia. So this carotid sheath, it is more thick around the carotid arteries, but whereas it is thinner over the internal jugular vein. So basically to allow for the expansion of the vessel during increased venous return. So on the wall of this carotid sheath, we have the formation of the ANSA cervicalis. So that is about carotid sheath. Then we will look at carotid body and carotid sinus. So there are two structures here which we see. So when we say first, let's look at the carotid sinus. Okay, so the carotid sinus. So carotid sinus, if you see, it's a fusiform dilatation. Okay, so it's a fusiform dilatation. Fusiform dilatation. Where do we see? At the terminal end of the common carotid artery, where the internal carotid artery begins. So here it is basically has a very rich innervation, which is contributed by the glossopharyngeal. So glossopharyngeal, vagus and the sympathetic plexus around these carotids. Okay, so all of them contribute to form the nerve plexus around this region. So this carotid sinus, you should remember that it acts as the baroreceptor. Baroreceptor or the pressure receptor. Okay, so it is sensitive to the change in the pressure in the cerebral arteries. So it basically regulates the blood pressure within the cerebral arteries. So there is something known as carotid sinus syndrome. So in individuals who are sensitive, okay, who have this carotid sinus hypersensitivity, in carotid sinus hypersensitivity, so any pressure on this, okay, so any pressure on this carotid sinus will cause slowing of the heart rate, fall in the blood pressure and cerebral ischemia, which can lead to syncopal attack, fainting attack, okay. So these individuals will have sudden attacks of syncope on slight rotation of the head, okay, especially while wearing a shirt with a tight collar or something. So suddenly they try to rotate the head and they have this syncopal attack. So symptoms are usually relieved by doing a neurectomy, okay. So during the plexus, okay, so what do? We do a neurectomy, periarterial neurectomy, and the symptoms can be relieved. Then we have one more structure here, a small oval body, which we call it as the carotid body, and this acts as the chemoreceptor. Okay, so chemoreceptor. So it is a reddish brown body, which you can see here, and receives a very rich nerve supply from the glossopharyngeal, the vagus, as well as from the sympathetic nerves. So since it's a chemoreceptor, it responds to any changes in the oxygen and carbon dioxide content of the blood. So the excess of carbon dioxide or decrease of oxygen tension will stimulate this carotid body, and it will cause increase in the blood pressure. It causes increase in blood pressure and heart rate, okay. So that is about carotid sinus and the carotid body. Next we move on to ansa cervicalis. So the ansa cervicalis, so this loop, okay, this loop is called the ansa cervicalis. So it is a U-shaped nerve loop present in the region of the carotid triangle, that is on the anterior wall of the carotid sheath, okay, it's embedded within that. So here this is derived from C1, C2 and C3, ventral rami of C1, C2 and C3 spinal nerves. Ventral rami of C1. So basically this ansa, it supplies all the infrahyoid muscles except, okay, that exception you should know, that is thyrohyoid, okay. So this one, this muscle, thyrohyoid muscle, so thyrohyoid muscle is supplied by the hypoglossal nerve, by the nerve to the thyrohyoid, which passes through the hypoglossal. The fibers of C1, they pass here through the hypoglossal nerve. So they supply this thyrohyoid muscle. So the ansa cervicalis is formed, okay, it has two roots. One is the superior. So this root we call it as the superior root, and this root we call it as the inferior root, okay. Superior root has also other name, it is called as the descendants hypoglossi because it is coming from the descending branch of the hypoglossal nerve. So this is the hypoglossal nerve, which gets contribution from C1 spinal nerve also. The fibers are running along with it, and from there the descending branch, okay, it is contributing to the formation of ansa. So descendants hypoglossi it is called, and the inferior root is contributed from C2 and C3 spinal nerves, okay. So they wind around here and they both join, okay, and form the ansa, this loop, U-shaped loop, which we call it as the ansa. So the superior root will give branch to the superior belly of, so the superior root, superior belly of omohyoid it supplies, whereas the ansa supplies the inferior belly of omohyoid, then sternothyroid as well as sternohyoid. So these are the structures supplied by the ansa. So remember that it supplies all the infrahyoid muscles except for thyrohyoid, and the loop basically supplies three muscles: the inferior belly of omohyoid, sternothyroid, sternohyoid, whereas the superior belly is supplied by the superior root. So let's solve some of the image based MCQs. So a triangle region here, this is the triangular region bounded by the midline, anterior belly of digastric and hyoid bone is shown. A lymph node is enlarged here. So lymph node in this is basically the submental triangle, half of submental triangle here, which they have mentioned. So the lymph nodes are the main contents there. This is the anterior jugular vein. So these lymph nodes are enlarged because it basically these from the tip of the tongue and all is drained mainly into this lymph nodes. So this is the submental triangle. Answer is B. A triangle bounded by mandible superiorly and digastric muscles inferiorly is shown. Which structure is most likely found within it? Okay, there are many structures. So let's see among the choices which are more common. External carotid artery in the posterior part, yes, we do see, but here when we see mainly it is the facial artery. Okay, so these two we see it in the most posterior part. So since they have said by the mandible and the digastric, so it is mainly in the anterior part of the triangle. So we are choosing the facial artery as the more likely choice. If a patient presents with a penetrating injury just posterior to the sternocleidomastoid at its mid portion, okay, involving the occipital triangle, which of the following structure is most at risk? So in the mid portion, what structures were emerging there? We had mainly the spinal accessory nerve and the four cutaneous cervical nerves, right? We had the great auricular, the transverse cervical, the lesser occipital and supraclavicular. So let's see which structure. So phrenic nerve, no. Brachial plexus trunks, we see it in the subclavian triangle. Spinal accessory nerve, yes. External jugular vein, it is the superficial content, we see it in the roof, not at the posterior to the sternocleidomastoid. So most likely answer is the spinal accessory nerve. A stab wound in the carotid triangle endangers which structure that lies within the carotid sheath? So carotid sheath, what happens is the carotid arteries as along with the internal jugular vein and the vagus nerve, which is posterior. So the medial most will be the carotid artery and the internal jugular will be lateral, and which is surrounded by the carotid sheath, which is very thinner around that, but whereas around the arteries it is thick, right? So it is lateral. So stab wound, usually it goes to the lateral side there. Generally when they hit and when you turn, usually the lateral most will be affected. So we have the internal jugular vein as the likely answer there. Then during a central line insertion, the needle is inserted in the lesser supraclavicular fossa. So it is in this region. This corresponds to which triangle? So usually we insert there central line. Central line, when we have to insert, it has to go to the right atrium. Okay. So we insert through the subclavian. Subclavian, they go to the brachiocephalic, subclavian vein, brachiocephalic vein, and then we have the superior vena cava and opens into the right atrium. So it is basically the subclavian triangle, okay, which is the right choice. So that's a wrap on the triangles of neck. So be consistent with the series, as consistency is the key to success. So I'll see you